I'm going to introduce, as you're standing, I'm going to introduce the next speaker, Dr. Sahib Singh Khalsa. He and I grew up together actually in the 3HO Sikh Dharma community. Yesterday was Yogi Bhajan's death anniversary, his barsi, and been thinking about him a lot during this conference. Dr. Khalsa went to school in India. He went to boarding school there for most of his life. He speaks Hindi, so if you want to speak with him later. But he is an MD and a Ph.D. He's a neuroscientist and a psychiatrist. He did his training at the University of Iowa and his residency at UCLA in the Anxiety and Disorders Clinic. He now recently moved to Tulsa, Oklahoma, where he joined the Laureate Institute for Brain Research, and he looks at the brain, body, heart connection. And he will be speaking to us about novel approaches for dealing with anxiety and other issues, particularly looking at flotation. So I'm going to let him take it from here.
Thanks so much, Niranjan, for that lovely introduction, for the invitation to be here at this conference. I'd also like to thank Dr. Chappell and the sponsors of this meeting. Who would have thought that, about 6 years after we both were freezing our butts off in the Midwest, we'd both be here in Southern California, sunny, and in the same work-related context. So I really appreciate the invitation. So my talk today is going to focus on mind, body, and brain and some work that I've been doing to investigate neuroscience-based investigations of contemplative practice. And this really, for me, is going to be a lot of the past work that I've done, some of the present work that I'm excited about, and a little bit of, I think, where the future might go for the work in my laboratory. I have nothing to disclose. I do have research funded by the National Institutes of Health and some private research foundations. And as Niranjan mentioned, I did move a few years ago to the Laureate Institute for Brain Research, which looks like this. It's a psychiatric clinic and hospital. So my clinic is about here. I specialize in treating anxiety disorders, including a subspecialty in anxiety disorders in patients with cardiac arrhythmias, something I started at UCLA. Our psychiatric hospital is over here, and I think the approach to care is very holistic. So the first thing you'll see when you walk in is this beautiful waterfall, and it has a counterpoint of this building right here, which is the Brain Research Institute, where I spend a lot of my time. So I think that, as we know in psychiatric treatment, it really is important to look at both your physical environment, your mental environment, and I'm very pleased to be associated with this institute. So my talk today is going to have three parts. The first part, we're going to talk about inner body or interoceptive signaling, and I'll explain what that means in a little bit. The second part is going to focus a little bit more on contemplative traditions, some of the work that I've done in the past. And the final part of the talk is going to end on a novel approach that I'm excited about for investigating both interoceptive and contemplative experience. So, what do we mean by interoception? Has anybody heard of that word before? Raise your hand if you have. Okay, well, we're doing pretty good. So interoception really is how the brain senses the inner body. And you all know about a peripheral nervous system and a central nervous system. And your brain and your central nervous system receive information from your body all the time. And here are just a number of the organ systems that constitute interoceptive channels, mostly, again, from within the body. We don't know a lot about interoception, really. This is just a timeline that shows you all the scientific articles published in the English language on interoception that specifically refers to it. The term is actually over 110 years old. It was introduced to us by a British physiologist named Charles Sherrington, who's better known for his Nobel Prize in relation to conceptualizing the synapse. But he was a very smart guy, and he looked at the brain, and he looked at the environment, and he saw that there was both an external environment, which he called exteroception, an internal environment, which he called interoception, and proprioception, sort of somewhere in the middle. But what you can see from this figure is that it took over 50 years for there to be any headway in studying the process of interoception. And in particular, you can see in the last 10 years or so, we're really beginning to see a lot of interest and inquiry in this area. So let's talk a little bit more about it. So interoception is really more than kind of a sixth sense. And what I hope to emphasize for you is that the brain uses many systems to sense the state of the inner body. These are systems that you may or may not be aware of. In fact, most of the time, you're not really aware of what's happening with your blood glucose, with your body temperature, your level of thirst. And there's probably an important reason for that, right? If you were consumed with knowledge of all of this information, it would be really hard to focus and concentrate. However, sometimes certain sensations become very clear. So anginal chest pain, for example, right? A signal of a potential source of threat to your mortality. This can be a critical signal that can lead you to receive urgent care. And we know that women, for example, are less likely to sense angina when they're actually having a heart attack. I see a lot of patients with anxiety disorders, and they come with palpitations, which don't indicate an abnormality in the heart, but rather somewhere else in the nervous system. So most of the time, this is kind of what you experience. But every now and again, when something comes to surface, you can perceive the inner state of the body very clearly, and it's this kind of perception that I, as a psychiatrist, am very interested in terms of understanding the symptoms that my patients report, that bring them into the clinic, that they perceive as very problematic in helping them to live their lives. So most of my lab work studies cardiovascular perception and the heart-brain connection. And I wanted to start with just a general survey and ask all of you folks here in the audience to raise your hand if you can feel your heartbeat right now. Okay, so that's about 40% or so of the audience. For a number of years, psychologists and psychophysiologists studied this process. And it turns out that you guys are quite accurate. So these are some of the studies. On average, sitting in an audience, as you all are, only about 1 in 3 people can actually accurately perceive their cardiovascular sensations. We were very interested in this as when I was in graduate school. As Narinjan said, I came from a contemplative background. And I thought a lot about meditation practice and yoga practice and was very interested in understanding what are some of the neural correlates and the physiological correlates of contemplative traditions, particularly meditation and yoga. And we conducted a study where we evaluated cardiac awareness using these same standard paradigms. Our hypothesis at the time, I was at the University of Iowa, our hypothesis was that experienced meditators would derive a greater sense of their heartbeat as a result of the practice. And this is the data from that study. And what you can see is that, in general, there wasn't clear evidence for increased awareness of the heartbeat under resting circumstances. Interestingly, if you look at the physiology of cardiac perception, you can take somebody else's heart and transplant it, and transplant patients still have about the same perceptual awareness under resting conditions. So it sort of tells us something interesting about this number, but it didn't really help us understand more about the scientific basis of meditation. Now, another question for all of you. Raise your hand if you've ever had a strong feeling of your heartbeat. Okay. 100%. Okay. If you were to think about conditions in which you had a strong sensation of your heartbeat, what would those be? You can just shout them out. Okay. Exercise, stress, fear, running. The other one I often hear is sex, right? Maybe driving on the 405, as we heard in our previous talk. So I'm very interested in that process, and that process has a lot of relevance for mental health, for anxiety, for fear, and for stress, And as we know, stress kills. So how do I study that in my lab currently? Well, basically, we use pharmacology, what we know about how the brain and the body communicate, and we use a pharmacological agent to simulate that feeling of stress in the body. We use a very particular molecule called isoproterenol. This is the chemical structure. You can compare it against epinephrine or adrenaline, and you can see that they're almost identical. What we know about this particular process, it's part of your hypothalamic pituitary adrenal axis, and under conditions of stress or arousal, your brain will signal your hypothalamus to encourage secretion of ACTH from the pituitary gland, which will then stimulate your adrenal glands, which sit on top of your kidney. And you have two kinds of stress responses. You have a cortisol response, which is more delayed. Cortisol tends to change gene expression. It's been involved in mental health conditions such as trauma, sexual trauma, et cetera. But we're really focused on this epinephrine and norepinephrine signal, which is much faster. It happens on the order of seconds and minutes. These two hormones are actually secreted from different parts of your adrenal gland. So epinephrine and norepinephrine are secreted from the adrenal medulla, which is in the middle, whereas cortisol is secreted from the cortex. What's interesting to me about this process is that all the medical textbooks will tell you about the Hpa axis, and you've probably all heard of that. We know very little about how the Hpa axis communicates to the brain, what areas of the brain are actually involved in sensing that surge in adrenergic overdrive. So isoproterenol is great from this perspective because it stimulates adrenergic receptors. It stimulates receptors in your heart and your lungs peripherally. It doesn't cross the blood-brain barrier very well, and when you give it in a bolus dose, a very small infusion, you can change the state of the body and record how somebody feels. So most of what I do in my lab is study sort of cardiac and respiratory sensation. This is an example of what happens in the body. So if you infuse somebody, here's their heart rate. If you infuse somebody with a small dose of isoproterenol, say a 2 microgram bolus, within about 30 seconds you'll see a brief spike in the heart rate, and within a couple minutes the heart rate comes back down to baseline. It's like maybe what happens if somebody cuts you off when you're trying to get to your exit on the 405. How do you feel that? Well, we ask our participants to just turn a dial and to rate what they feel in real time so we can get a sense that, okay, here this person felt an increase in the sensation, it had a certain trajectory, and it came back down. We've looked at this process repeatedly. This is an example of a nice dose response with isoproterenol, how it affects the body. And this is how it affects perceptual sensation. And what you can see is that mostly it takes higher doses for people to feel something. You get a very usual placebo response, about 30%, and at higher doses you can get everybody to feel something. So when you look at how it affects the localization of body sensations, most people feel those sensations in a region that most physicians will notice as the point of maximum impulse, where the heart strikes against the anterior chest wall. So we've really been focused on trying to understand what areas of the brain process this sensation, both from an interest in contemplative practice as well as mental health. And we've had some success recently in identifying a particular region of the brain called the insular cortex. This is a study published last year just showing that when you look at brain activity during this period of time when the heart rate rises, you have a very selective area on the right in the insula that responds. Now, most of you raise your hand if you've heard of the homunculus, or sort of somatosensory cortex, sort of the map of the body on the brain. So that's on the surface of the cortex, but as you can see here, the insula is deep. And what we're learning is that that region seems to be more sensitive to internal sensations rather than peripheral skin sensations. We're learning a little bit more about the stages by which the insula processes this information. So we recently replicated this finding of the insula on the right responding to changes in the body. But when we looked in this later on phase, when people's heart rates had recovered, but their perceptual experiences were still trailing, we found an expansion of activation in other subregions of the insula. And so, again, we're learning more about how the Hpa axis speaks to the brain, potentially how that relates to conditions like anxiety and depression. That's more for future work. I mentioned this interest in studying contemplative traditions. So there has been an explosion of studies of meditation, and I love this figure because it always reminds me to mention that when you look at meditation, there's really not clear evidence that animals do it. And when you look at sort of the scientific definitions of meditation, it's this self-regulation of attention. There's a lot of intention, and it's possible that dogs and cats do a form of meditation, but certainly in terms of the traditions and the way that it's taught, it's very unique to human beings. And it's another thing that I've always been interested in is sort of what are those processes that make human beings so unique of all the animals, and what is it about our brains that do that? I mentioned this study here on the bottom because there has, as you've heard at this conference, there's a lot of excitement about the potential for yoga and meditation and mindfulness, and we've heard about some of those studies. This is an interesting study because it was a head-to-head comparison of mindfulness-based stress reduction with cognitive behavioral therapy, a standard psychotherapy, finding them to be more cost-effective. So I think that was very interesting. As a graduate student, I was very interested in contemplative practices, and this is a study that we conducted where we looked at two groups of meditators, so Kundalini yoga meditators, and Tibetan Buddhist, sort of expert practitioners, people with more than 15 years of practice. And we were operating at the time under this basic assumption that meditators would have more awareness of inner body sensations, because if you look across traditions, that's one of the earliest focuses of attention. It was a very early and a very basic hypothesis. What we found really, to our surprise, was no evidence for that. In other words, their perceptual accuracy for the heartbeat really didn't seem to be appreciably different in these traditions. And that was, again, was to my surprise. However, when we looked at other elements of the task, sort of metacognitive elements, like how difficult was the task, or how accurate do you think you were at it, we did seem to find a separation where the meditators in both traditions felt that, it wasn't that difficult for me to pay attention to my inner body, and I thought I did, okay. And so what this illustrated is this notion that some of the effects of meditation maybe have less to do with a peripheral physiological mechanism, like a change in the actual body, but more change in terms of how somebody relates to their body. This was actually replicated in several studies over the last 5 or 6 years. As a graduate student, it kind of led me to wonder about that state of adrenergic stress, and are meditators really more aware of changes in the body, and particularly some of these acute stressful changes, adrenergic changes. So we conducted a study with a different group. This was a group of Vipassana meditators. Some of the earlier reviewers of these studies said, well, and even some of our participants who were Tibetan Buddhist monks, for example, well, I don't really spend a lot of time focusing my attention on my heart. Well, in Vipassana, that's kind of one of the early and core practices. If you do a silent 10-day retreat, you spend a lot of time paying attention to inner body sensations. So we recruited people who had done at least one Vipassana retreat within the last year, who had a daily practice for over 2 years. And we brought them into the lab, and we asked them to undergo this very invasive protocol where we put an IV and we injected this drug intravenously. And again, to my surprise, and against the hypothesis, we found this evidence that really there was no increased perceptual accuracy in the meditators, no increased detection of changes in the bodily response. And when we looked at these relationships between peak changes in the body and peak perceptual ratings, we found that there were these robust correlations in non-meditators that seemed not to be evident in the meditators. We wondered, what did that mean? Was there something different about the way that they were feeling their body? So one of the things that we always do is we have our participants localize the sensation in their body, and you can just sort of reflect back on your own sense of your heartbeat and where in your body you may have felt it at certain times. Do you feel it in your chest or in your throat, in your head, etc.? And so this was the map of the non-meditators, and this looks very similar to the map that I showed you in the past. again, at the highest doses peaking around the point of maximum impulse. And this is what we saw in the meditators. So we did see some evidence for a difference in the localization of the sensation. We don't know exactly what it means, but it definitely suggested that there was an expansion of the perceived sensation throughout the body. And we're still in the process of writing that up. We have a lot of questions about it, but I wanted to share it with you because I thought it would be pertinent for this conference. So to conclude the middle part of this talk, it really seems from this research that meditation practices don't seem to be clearly associated with an increased perceptual accuracy for cardiac and respiratory signals, but it does seem to be associated with altered representations of inner body states. This actually mirrors some of the data that you'll see in the pain literature, where people have studied whether expert meditators experience pain differently. There have been some findings suggesting that the intensity of pain is equivalent across the same stimulation, but it's the bothersomeness of it. The experienced meditators seem to not have as much discomfort with that intensity of pain. So again, if you think about what those mechanisms might be, they're most likely to be higher in the central nervous system rather than in the periphery. Okay. So I'm going to finish the talk by presenting a novel approach that I think is potentially going to be useful for both studying interoception as well as contemplative experiences. And I use that term loosely here in the talk, and you'll see why. So who here has heard of floatation therapy? Raise your hand. Wow. We've got a great audience. So over 50%, about 60%. So around the time that I was contemplating leaving UCLA to go to the Laureate Institute for Brain Research, my colleague, Justin Feinstein, who's a clinical psychologist, told me about this floatation therapy. He said, you've got to try this. I think it's going to be right up your alley. And I was very skeptical. He took me to a place in Venice that basically, there's this sort of ice chest looking thing, and there was a hatch, and you open the hatch, and you go in this, basically this looks like a cooler with about 11 inches of water in it. You close the door, and then you just lie down, right? Who would do that? Okay, you're braver than me. So I refused the first couple times, and eventually I was willing to try it, and I had a very interesting experience. And here's sort of a little bit of what the experience was like for me, and it sort of mirrors what several other people have described. And this is an example of a newer float pod, by the way, but this was a study, or this was a brief write-up that Time magazine did with Justin. But basically, I went in and I put some earplugs on because it turns out the water was really, really salty, full of Epsom salts, bath salts. Again, I closed the lid, so I was in total darkness. In fact, when it's done correctly, there is not even a single photon of light that'll hit the retina. So you could open your eyes or close your eyes, and you can't see the difference. The air and the water were about the same temperature as my skin. So if I laid still, there was a moment where I couldn't feel where my body started and ended, right, until I wiggled my hands. And importantly, I mentioned the Epsom salt. I didn't have to hold my breath to stay afloat. I could just relax into the water because there was over 1,000 pounds of Epsom salts. As Justin likes to remind me, it's more salt than the Dead Sea. Anybody been to the Dead Sea? All right, great. So one of the other things that I found fascinating about flotation is that if you look at the number of float centers, so there are lots of places around the country now that you can try it, it's really been taking off. And I think anytime you have a large group of people taking an interest in something, I think it's worth studying. So this was the latest estimate of the number of float centers in America. Now, the thing that got me really interested in this was really my background as a neuroscientist. So this is a brain. I guarantee you we all have one in this room. And I really started to think about what is the underlying neurological basis of this experience. And I started to think systematically about what this very odd environment was. And this was sort of the map that I came up with, both Justin and I over discussion. So when you're in a float environment, usually the light is off, so your visual system isn't really receiving any information. There's nobody to talk to or to hear anything. In fact, usually the pods are noise isolated, so you don't hear anything. So that takes out your external sort of hearing apparatus. You don't move, so proprioceptive signals aren't disturbing the brain. And there's really, again, if you're not moving, you're not generating any motor signals. Now, does any of this seem similar to meditations that you've done before? Raise your hand if you think so. Right? Okay. So a lot of people who enjoy floating, and even in some of the float centers, you'll see advertising that this is a way to meditate or to jumpstart a meditative state. And certainly over the years, people have said that to me a lot. I don't think that that's necessarily the case because when I went in, I wasn't given any particular instruction of what to do with my mind. I'll note for you that you have your prefrontal cortex here, which could go wild. And there's a whole nother element, of course, which is your interoceptive system, right? So most people, when they float, will report to you that they had a very prominent sensation of their heartbeat and their breath. And if it made me think immediately about some of my patients with anxiety disorders who don't want to feel their heartbeat or their breath and who don't want to go into claustrophobic situations, right? So how is it that many people were experiencing this environment as positive and yet it seemed to have the potential to trigger lots of anxiety? So Justin, being the future thinker that he is, when he moved to the Laureate Institute for Brain Research, this is what he built. So this is our open float pool at the Laureate Institute. And it looks very different from the previous pool that I just showed you. And in fact, I didn't even show you one of the early pods, which look more like coffins. And those of you who have been around for a while know that the older term for this is sensory deprivation. And so very different. Justin built this with patients in mind, particularly patients with anxiety disorders, people with claustrophobia. You can see that it's a much larger pool. It's 8 feet in diameter. It's round, so if you move around a little bit, if you fidget, you create these concentric circles that then self-center you. So if you lay still, you won't touch the edge. And people who've tried floating before will tell you that it's a little jarring when you bump the edge because all of a sudden you come back to your body. So what we've been doing over the past 2.5, 3 years is building the float center and then studying it both from the standpoint of perceptual experience, symptoms relevant for anxiety and depression, as well as the neurobiology. So the first thing that we noticed immediately, and this is a study in healthy individuals, is when we asked them how intensely they felt interoceptive sensations like the heartbeat or the breath, or the stomach and digestive system, and before lunch you heard a great intro to the gut-brain connection. So basically, if this is what somebody reported on average, this is what the group reported on average before the float, this is what they reported on average after their float. And this is just data from a single float. Significant increases in the perceived intensity of the breath and the heartbeat, but not the stomach or the digestive system. And so if you think about 20 or 30 years ago, this notion of sensory deprivation and that going into this environment is one in which you experience no sensation, this is data that would suggest directly that you experience an interoceptive sensory enhancement. But that's not really why people seem to enjoy floating. People seem to enjoy it because they feel more relaxed, they feel less stressed. Maybe it makes driving on the 405 a little more tolerable, who knows. This is some data to support that idea. So this is a paper that's under review right now where we floated 50 patients with a variety of anxiety disorders. The vast majority had comorbid depression, major depressive disorder. And all we asked them, this was a single float, open label, they knew what they were going into, none of them had floated before. We just asked them to rate before and after what their negative emotional experience, their pain, fatigue, depression, state anxiety, stress, muscle tension. So these are all things that decreased from pre to post float. This scale here is in percentage of maximum possible, so we use a number of different psychometric instruments, but we scale them all on the same axis, so you can see that this decrease in muscle tension represents about 45% of the maximum possible range on the scale, so you can equate the two. So we get decreases in lots of those negative aspects of perceptual experience, and significant increases in feelings of serenity, refreshment, relaxation, energy, happiness, positive affect. Okay? So these are statistically significant, but that doesn't necessarily tell you how large the finding is. So this is now an effect size estimate. Those of you who are statisticians or who know your statistics know that a Cohen's d of 0.8 is considered large. And what you can see is that in some cases, particularly refreshment, state anxiety, serenity, muscle tension, we see very large effect sizes with a single float in this population. So I'm really honored to be here to be presenting this data and the work that I've done to some of the originators of work on the relaxation response. And this notion that with meditation, seems to be a concerted physiological set of events that leads to parasympathetic reductions, or enhancements in sympathetic reduction. So one of the things that we've been looking at is the idea of whether floating induces a similar type of relaxation response. And we haven't investigated things like nitric oxide yet, but we're really just starting simple. We've tried to figure out how we can record blood pressure in a wireless and waterproof way. We've been able to do it, and this is some of the data. So floating, it seems, does actually acutely lower blood pressure. So this is data in patients now. Not patients. Some of these patients may have hypertension, but these are really patients who are recruited on the basis of anxiety and depression. And you can see that as early as 15 minutes after the float, you see a significant reduction in systolic blood pressure as compared in the float as compared to this film condition. This film, by the way, and I'll show you a little more data on that, the patients were sitting upright in a chair watching the latest Earth documentary series. So the idea is a bit of an exteroceptive control. We also see some pretty prominent and acute reductions in diastolic blood pressure. These seem to happen more immediately in the float, but they do seem to be sustained throughout immersion in this environment. So this is another study where we really looked at, it was a randomized crossover design where we had patients come and float once, and then we had them come and watch the Earth video. And what you can see is that the float environment seems to preferentially increase feelings of relaxation and serenity, and decrease ratings of muscle tension and anxiety as compared to the video condition. We've used these body maps to characterize that. So what you can see is that pre-film versus post-film, this is a rating of where in the body muscle tension exists. And you can see that if anything, it seems to increase in the back. Whereas with the float, it actually seems to decrease. Now, those of you who have floated before may note that neck tension. And a lot of times we find that people, when they go into a flotation environment, are so concerned about their inability, that the idea that they'll sink, that they actually kind of hold their neck stiffly. So I suspect that will go away over multiple floats. I just show this cardiovascular system here because when you think about reductions in skeletal muscle tension as well as reductions in blood pressure, which may be mediated by reductions in smooth muscle, again, this is data I think that suggests that floating may be a potent stress reduction technique. I'll finish up. We've looked at this in another population. I study Interaxial Nervosa, which is a very chronic, unremitting condition characterized by high elements of anxiety. And this is a 4-float study now. This was actually a safety study, so we were looking at whether these patients could tolerate the blood pressure change. This is a secondary outcome. But basically, when you look across 4 float sessions, you see these substantial increases in self-reports of energy, in feelings of relaxation. In particular, I find interesting the fact that the more floating goes on, the higher the effect seems to be. We see the same pattern with feelings of refreshment and ratings of stress. And this is a stress reduction, up to 25% on that scale. In case you want to know what the patients themselves felt, these are the anorexia nervosa patients. This is just a sampling. We debrief everybody after each float to get a sense as to what they experienced. This is certainly consistent. So this is somebody who, I didn't feel my outer body for a good amount of time. I felt very refreshed. I even noticed that my physical appearance before and after had changed a bit. We're actually seeing on a measure of body image disturbance, which is one of the last things to improve in treatment for anorexia, that we actually see some acute changes on that scale. Here's somebody who noted that their back pain completely went away. We're interested in studying the effects of this on pain. So to conclude, I just want to say that we're making some substantial progress in understanding the neurobiology of inner body sensation, or interoception. I've shown you some evidence for differences across contemplative traditions, and I've talked a lot about flotation rest as a novel approach worth investigating as a tool for treating symptoms of anxiety, stress, and potentially for physical health conditions. So we're in the process of planning some randomized controlled trials, and I hope to be able to publish those at some point in the near future. So again, I want to thank everybody for the invitation to speak here, and my team.
Okay, is Jeff Ono in the house? Did Jeff Ono make it? Okay, so he said there's a problem because is it really meditation or not? I'm Washington, there's a place called Pause that is run by Jeff Ono, who I thought would be here today. And I've taped a meditation for them.
Oh, cool.
So, yeah.
I'd love to get my hands on that.
Yeah. So, quick question.
I could have saved you all that money and told you it works. But how long do the effects last?
That's a great question. So the question was, how long do the effects of a float last? We really don't know. I think that when you ask individuals, you'll hear hours to days. I know of several patients. I know a woman with fibromyalgia who floats 3 times a week and finds that that is enough to control her pain. We're studying this in the lab, so we have a smartphone app where we text people for certain periods of time after each float, but we don't actually have the data analyzed yet. I suspect it's somewhere between 6 hours and 48 hours, but I don't have the data to speak to that right now.
Okay, thank you.
Thank you.
So